have a 30 years experience in internal medicine, and my subspecialization was critical care medicine. So I'm almost 30 years in critical care medicine, but for the last 3 years, I shifted my my subspecialty to anti-aging medicine and functional medicine, regenerative medicine. It's like a change to see, as we have to go with the trend and life, and also point in anti-aging functional medicine. We study the conventional medicine. Conventional medicine is as you go, it's more reactive medicine. So you go there, it's a disease specific, so you treat, and there's but in spite of that, chronic disease now accounts for 80% of cases worldwide, which is a major problem. So the functional medicine is in fact, yes. So this is and the anti-aging in fact is extending the healthy lifespan of the individual, and in fact that you don't want anyone individual to have, by the age of 40, 50, he's on about 10 medications, and still he will go on and off on high bills and more complications in spite of the medication. So the anti-aging functional medicine approach is to minimize and also to optimize the wellness and health of the, and also making energy in a way that it is more suitable for him without any complications, or safer. So the role of the flavonoids here is that it comes from the food, in fact, and it inhibits the pathway. The most common pathway it inhibits is two pathways, the MAPK and the FF-kappa beta pathways. And these pathways has a role in the microglial activation. So it inhibits the microglial activation, number one. It inhibits the activation of pro-inflammatory cytokines. It inhibits the neuronal inflammation, and also it reduces the progression of the neuronal cell death. So it can slow down the disease. And in fact, if you go back a few years back, there was an interesting case of multiple sclerosis. Dr. Walls, if you know, she had multiple sclerosis, and she was even chair-ridden, bedridden, and they told her that you cannot survive with this severe multiple sclerosis. She dedicated to plant-based diet, which flavonoids was in it, and now she's back to the last few years. She's back to normal life, and based on a lifestyle intervention, we include the flavonoids. And just to note that 80% of the chronic diseases can be reversed if you just appropriate dietary lifestyle. Right. Just to add, what flavonoids you have, just examples, have flavonoids which are in onions and apple and tea, olives, peanuts, sesames, potatoes, sweet potatoes actually, and also in green tea. So these are just to give you some ideas. Just eat it well, natural, no harm, safe. So functional medicine is one of the branches of medicine, in fact, and has been evolved for the last 15 years, in fact. And it focuses on the root cause of the disease. So when I say the root cause of the disease, there are almost 5 to 6 factors. Allergy, toxins, stress, sleep issues, and physical movement. Okay. Now, when we assess the patients, there's a very long list of questionnaires we have, and we spend almost 60 to 90 minutes to see the root cause. And the root cause is not from just the day the symptoms start. No, we dig out till the day he was born or she was born. Even during the pregnancy, how was the mother doing? Because the reason is that, as we know now, the new, and I mean, in my days in our medical school, we didn't know that the microbiome or the gut microbiome was important as today. Today, we know that 80% of immunity is in the gut microbiome. 80% of serotonin hormone, which is the happiness hormone, is secreted by the gut. The vagus nerve, which has control on the brain and the gut axis. So based on that, any change in the microbiome can cause any disease in the future. And disease, the trigger of the gut microbiome could be from the stress, could any food, any environment, and so on. But just to make it understand to the audience, we are all have genetic factors, okay, genes. And if I have a patient, say he has cancer or he has heart disease, the first and second generation will inherit the gene. All right. Now that person can control his gene by switching on or switching off the gene. So because 10% is gene, 90% is controlled by the person, and controlled by what? By the environment, which is the food, the stress, and everything. So if the person has his father or mother had cancer, he can stop from developing cancer just by developing a proper lifestyle. But if he continues the same habit of his ancestries or poor diet or so whatever, then he will develop. See, so just to make it clear, the patients have the control of, and all ourselves even we can control our genes in 90% in order not to develop. So functional medicine is, you can say, is focus on the root cause. Anti-aging medicine is focused on the treatment related to age-related disorders. And when it comes to aging, people think aging is about 40 to 50 years old. No, aging starts from 20s or 25. If you had a normal healthy life before, but with the current standard right now, I don't think everybody is aging from 25 years earlier because, with the junk food and stress and everything. So I think everybody has to investigate in their young age, because no disease will appear in 24 hours. Diseases appear as accumulation of years of proper inappropriate lifestyle. That's why. We see that how that goes. Okay, metformin is, as we know, it is a drug for diabetes type 2. The studies have showed that there is some beneficial on the anti-aging, but in healthy individuals. Okay, so they haven't studied on any people who had chronic disease or diabetes where there's anti-aging. That's number one. Number two, there is a recent, just I read today, that if you take in healthy individuals, if you take metformin and you exercise, then the metformin may impede the exercise benefits. And we know that exercise is important for aging, for anti-aging. So that's why the recommendation is that there are many studies on drug interactions, but there's no studies on drug to exercise interactions. So I think this should be also, those who are interested to do any further studies or whatever, I think drug exercise interaction will be very important in the future. So my conclusion is that metformin can be beneficial on selected individuals, okay? But you have to wait until proper control randomized studies has to set up, because it's still it's still a drug which can go down with your glucose. So I think you have to wait for a while. The phytoestrogens, as I recall, is you have berries, you have, just to make it clear, what is it, this phytoestrogen? Some physicians or students will ask. They are plants, okay, from the plant. It's safe and natural, and usually the estrogen goes down, especially in women as they age, and that's what we call hormonal aging. So the phytoestrogens are small molecules. They're similar to estrogen, but derived from the reproductive parts of the plants. So examples are grapes, seed cloves, and soybeans, flaxseed, several nuts, and berries. So this is the conclusion. So it is beneficial compared to the oral retinoids, but I think important for any patient, they should, before see a cosmodermatologist for the appropriate, whether they should take oral retinoids or they should take phytoestrogen. Because phytoestrogen, you cannot give it to someone who has breast cancer, you cannot give it to who's pregnant. So they are selected, and also vice versa to the oral retinoids. There are certain contraindication indications. Plus, never advise to patients to take over-the-counter medication or supplements like this, because low-quality brands can affect. So they should take it from a certified cosmodermatologist physician. That's interesting. Senotherapy. Yeah. So just to what is senescence? Senescence. Senescence is as we age, there are dead cells, and dead cells are called senescent cells, and which appears in various parts of the body. And the last 3 years has been there's starting evolving of something called senotherapy, and the senotherapy is to kill the senescent cells, okay, because senescent cells contribute to aging process, which is one of the end stage. Now is the question is, where is it evolved? It's quite too early right now, because even though they discovered 7 classes of senotherapy, one is quercetin, but still they said that the senescent cells can be different from one area to another. So if you're going to target senescent cells, in the future you may not include one class of agent, you may include several agents, because it has different signals from different cells in different areas, have different markers, and have different pathways. So I think it's too early to say, yeah, but as long as we started, we never know in 20 years, there must be something, but I'm quite optimistic about it. Okay, the best study came out a few days back, and it came about reversal biological age by 3 years. And this was by diet and lifestyle intervention by Dr. Carla Fitzgerald. And she set up 43 gentlemen, divided into 2 groups. Each group, one group was normal lifestyle, whatever they do, what they want. And another group which was specific lifestyle intervention. And this lifestyle intervention was about certain dietary protocol. So they have to stop dairy food, they have to stop processed meat, stop any gluten, and they have to go on to take greeny leafy vegetables, certain amount, and cruciferous vegetables, and a certain amount of other dietary. I can send you the protocol, and you can distribute it to the paper, and you can distribute to all our colleagues. And then plus that was exercise and meditation, and it was for 8 weeks. And they measured what? They measured the methylation. And the methylation, as you know, methylation is a process of activity, enzyme activity, gene activity in the cell, which occurs about billions in 1 second. So any defect of the methylation will cause a problem, like in the future can cause cancer. But they measure the DNA methylation, because by aging, 60% will be losing. So they measured that in 8 weeks, and they found that there is a reduction in the aging of the DNA methylation, and significant. And they clocked it by biological age. It was around 3.2 years. So that's a significant, result. And I think the next plan is they're going to do for women, and I think they're going to be expanding to more group, because it's the protocol is safe. It's a normal natural food, you see, and normal life. So I think this is one of the papers. I will send it to you, and you can distribute it. It's very good for doctors to share with their patients. And it has significantly contributed significantly, because I'll give you an example. When we approach patients, neurogenerative disease, give an example, we go one by one step, okay? So if the steps of proper diet, proper exercise, proper sleep, proper everything is after 3 months or 4 months still not resolved any improvement, then we go to toxins, okay? And toxins can be started from before, but I think it's usually too early, unless from the history you suspect that the patient is, say, he's living in a poor environment, or his occupational exposure in the past was toxins, so on. So after 3 to 4 months, we go and do some functional medicine lab tests, which can detect molds, can detect certain toxins in the body, especially mercury. And even from the history, we can detect from the history, especially in the old generation, they had mercury filling in the teeth. So this is also a contributing factor to neurodegenerative disease. So once we discover that there is a certain amount of toxins, then we can go do some chelation therapy for them. And then in a short period of time, Usually the cycles of chelation therapy takes about 10 to 12 cycles. It's not one cycle and you see the improvement. And definitely you have to take the patient out of the triggering factor. So he's living somewhere there's a big exposure of toxin. He should be forward of the functional medicine toxins. And also we conclude also that it's not about also exposure of toxins, even our daily habits. Water, plastics, we have everywhere now, right? Microwave, we have cans, anything which is related to toxins, even skin products, right? Toothpaste, all these are toxins which we don't know. Wow. That's why it's very important that people should, before they purchase anything, they should either read about the labels and consult, because there are many toxins around. And even like just water, the what do you call this, plastic water, it has BPA, and most of them, they don't write with BPA, so you better take it from a bottle of glass than drink it from the directly. So this is a toxin. So there's a big good future, but I think if physicians are interested, they can go to functional medicine. I encourage them to go either integrative medicine, functional medicine, anti-aging medicine, whatever. They will enjoy it. They will see results, and it's something. It's the future of medicine, in fact. Yeah, genetics. I mean, genetics is already inside there, because functional medicine, anti-aging medicine, there is some area which they call it and genetics, or they call it nutrigenomics or epigenetics, and which is the gene expression. And this is where you control the expression of the gene, turn it off or turn it on. And right now, you know that many places in the world, you can do your what do you call the genetic test, DNA, and check what type of food you should eat, what type of food you should avoid, what are your risks for whatever, and depends on what you want from that, and what type of exercise even, and whether you have a high risk if you take caffeine a lot or not. So this gives you like a guideline, a book for you, where you can what do you call this, guide you. But just to make it clear to everybody, the DNA gene test, 90%, it is 99% accurate, that's number one, but it's important to see that it only checks about 70 to 100 genes in your body, number one. This is the common DNA test for healthy, for wellness. There's another test which came out about 1 month ago, which is the exome, and this detects about 22,000 genes. And it's a very comprehensive genetic test, and it gives you full detail about the risk of disease and what to eat, everything. So this is the best, but it's always is up to the individual. Go to what's the basics first, and then if you're interested more, you can go to the advanced. And based on that, we align the functional medicine, anti-medicine with this type of genetics, and we guide the patient to a proper lifestyle. Anyone interested to do, definitely you'll be finishing your medical school, you'll finish your specialty, but if you want to shift or change your specialty to something, transitioning to something else, like functional medicine, anti-aging medicine, integrative medicine, or lifestyle medicine, you have options, okay? So I start by the first one, functional medicine. Functional medicine, if you want to do it, you can do it in the Institute of Functional Medicine in the USA. You can do it online. There are 7 modules, okay? And at the end of 7 modules, you will take an exam, and there's 1 case study you have to report to them, or 2-3 case studies, and you have to report them, and you'll be certified. The average time to take these 7 modules around 2 to 7 years, because it's quite costly. But it's very informative, very structured, and you will learn a lot what you didn't learn as in the conventional medicine. That's number 1 for functional medicine. And you'll be labeled as a functional medicine practitioner. Okay, that's number 1. Number 2 is anti-aging medicine. Anti-aging medicine is a American board exam. It has an oral, it has a written exam, and it has also 6 case studies you have to report to them, and also other documents that they need, and takes the average time to study and take the information maybe is around 1 year. Okay, so that's but at the same time, the anti-aging medicine, after you finish or during your study, you can do their fellowship. They have 4 types of fellowship. One is fellowship in anti-aging functional medicine, fellowship in stem cell therapy, fellowship in integrative cancer therapy, and there's another one is fellowship, I think I can remember. But I think these are the 3 which I really recall, and this takes around maybe 2 years, which is an advantage because stem cell therapy is one of the things which is coming up right now, and integrative cancer therapy is another issue which is no oncologist doesn't know about it, and so these are for anti-aging medicine. It's an American board certification. Number 3 is lifestyle medicine. Lifestyle medicine, if you are in UK or USA, you can do. It's called, in USA, they do it for the American Board of Lifestyle Medicine. If you are not in USA, you are international, you can do it based on your country. It's called International Board of Lifestyle Medicine. The requirement is very easy. You have to attend 2 CME courses of their, and you have to do 1 case study, and then there's an exam. So it's more easier, but takes maybe around 1 year to finish the requirements and take it. So overall, if you ask me which is the best of these 3, that's a good question. I would take on functional medicine and anti-aging medicine because they are the 2 which are correlated together, and you will see different approaches as you learn. It's playing a major role, and in fact, just to make it clear, it is that most patients who had COVID-19, they had low-grade inflammation in their body. And when we say low-grade inflammation, it's not, yes, there's inflammation like diabetes, chronic disease, and so on, but those who don't have this type of disease, they have a low-grade inflammation, means that they had a poor lifestyle, poor diet, whatever they have. It's not a fear, but once the COVID comes to them, they flare up. So that's why it's very important to do more prevention in their lifestyle for every case of patient. So the recommendation is always, and in fact, they recommend even those who graduate now, because aging starts from 25, anybody who graduate should already start with the omega-3, vitamin D3, and other supplements, very important. So don't wait till 40, 50 years old, better do it as a doctor. And I got the green light to write self-assessment, multiple choice exam book for anti-aging and functional medicine from the Springers publishers. So it'll be out maybe by early 2023.